music.
A great welcome to you, our lovely listeners and viewers of Sun FM TV. I'm glad this edition of Health Talk. I'm your presenter. My name is Lamek Zulu, professionally known as Four Legs, hashtag the servant of the truth. Today, we are discussing a very important topic, and I encourage all our ladies, all our mothers, and everyone who is interested to make sure that you call your friends, your colleagues, and everyone else that you know to listen to this particular show, because the topic that we are discussing is something that we call a silent killer. So if not well taken care of, who knows, you might just be digging that grave for that particular loved one. Today we are discussing breast cancer. So breast cancer, I'm sure you've heard of this, and it's time that we actually I'm not an healthy expert, and to help me dissect what we have on the table today, I have my two guests.
So good so far. Thank you for having me today.
Nice. I know that weekends are not easy for medical practitioners.
Not at all.
Not at all. But anyway, let's dive into this. Let's start by establishing what is breast cancer. What is this? What is this animal that we're talking about medically?
Yes. Thank you very much for that question, Mr. Zulu. Once again, good morning to the viewers and good morning to all the listeners. So when we're talking about breast cancer, we're basically talking about cancer that involves the breast. In Bemba, someone could say chimumena, a public health problem in our country because it's associated with great morbidity and mortality. It can be found in men, as well as in men sometimes. It's common in women.
Okay.
But less than 1% of cases, you may be able to see them in men. Basically, in a nutshell, that's breast cancer.
That's breast cancer. I mean, I've just learned today that it can also be found in men. Anyway, I'm not an expert, so let's move on to another question. What are the
is that breast cancer can be categorized in two parts. There could be those what we call modified, and those non-modified risk factors. What I mean by modified is that there are those that you can have control over, and those which are not modified, where you may not have control over. To start with, some of the non-modifiable risk factors, I would start with age and sex on its own. So you may find that breast cancer usually is common to those who are above 40.
Okay.
Yeah, so age usually puts someone at risk. So when you start aging, you clock 40 and above, you are at risk of having breast cancer. Suffice to mention that it's not, I'm not saying that it cannot happen to compared to men. So you may find that maybe you may have 1 out of 100. One man reached menarche, wakule chisungu bwangu, and again, instead of those who take longer time to reach the menopause.
Okay.
Yeah, so abamba bwangu kwatema periods n'abarekeresha n'abachero okuleka.
Okay.
Because they have got that
because of maybe the hormones, the way
yes,
the body
yes,
is wired, yes.
Exactly. So there's that prolonged exposure to estrogen, and that actually predisposes someone to breast cancer. Those people who may not have children or who may have children at a later stage, they are also in
that. We've also talked about the risk factors. Now, Dr. Songwe, help us understand the warning signs or symptoms that people should look out for. For example, maybe before the hospital, what are some of the signs?
We need to discuss the issue of signs and symptoms, because that's basically what brings the patient to the hospital in the first place. However, before I even begin to mention any, we must know that sometimes you may not have any.
Simplify that for me.
Yes, please. So ulceration simply means okukweburuka kwati chironda kwati kulepanga chironda.
Oh, okay.
Sometimes tukwafene chironda chamoneka chapanga chironda, but ni cancer. Yes. So those are some of the things. And then apart from that, also other signs could be, you know, dimpling fili echipapa cha orange chimoneka kwati muri utwa tungamo. Sometimes ivere lilaruka mumusango uli awene.
What would want to encourage, apart from the self-examination, self-awareness, breast awareness. What do I mean by breast awareness? Chibirefyo mwinde shwira kwa wani cancer. So self-awareness is important. You first need to know your or palpation for in a medical term, feeling. You are able to touch. Sometimes you find that you may find a lump, or you find the chintuna chimenako.
Chiri burunkus.
Chiri burunkus. No manga omo kumfwe burunkus. It should give you a concern. Ero kuyikata kweka kufire kwa wafe kuivere kweka. Sometimes you want mina chambo kumena muma ampiti, which
So, you know, people shouldn't be scared to have, you know, their problem diagnosed, because a problem known is half solved, you know? Yes. So when it comes to diagnosis of breast cancer, there is a systematic and straightforward way that is employed, or rather that we use. So it's not something that's complicated.
Okay.
Okay. And this diagnosis, we call it triple assessment. Why is it called triple assessment? Because there are three aspects involved. The first aspect is clinical examination and history. So once you come, now we want to do imaging studies, because from our naked eyes, some of the things may not be visible.
Exactly.
Like I said, sometimes someone may not even feel anything at all.
Or
so
show
that's
any
why,
signs.
yes. That's why the issue now of imaging comes in. And when it comes to imaging, there are different things that we use. There's ultrasound, there's mammography, you know, there's MRI. Then we do our imaging. Now, after imaging, we want to ask ourselves, is this, you know, if we so much emphasize on early diagnosis, it means we're going to be able to pick the disease quite early.
Exactly.
And if we pick the disease very early, it means most of these will be amenable to surgery, or we could be able to do surgical procedures. And this...
So for the sake of my listeners, when you say surgery, you are talking about operation?
Operation, basically.
Okay.
Yes. So you find that when we pick this disease process quite early, we're able to do even breast conserving surgery, where you just get the lump out of the breast.
Breast yasha.
Breast yasha, you just repair where you make for either chemotherapy or radiotherapy.
Okay.
And early disease picked early is actually treatable, curable.
And also, more importantly, I think what contributes to that, you know, cancer, any form of cancer, sometimes in the early stages, there's no pain. And usually what brings the patients to the hospital is when they start feeling pain. But apparently, the moment you start feeling pain, it would have gone out of proportion. That may be an extensive. So the moment you start seeing or feeling pain, then just know that probably you might be dealing with apart from the breast might be affected. So with that regard, if the disease is gone beyond and it has gone systemic, what I mean by systemic, now because it starts on the breast, but you know the breast is not an independent. Maybe it started on the breast, but other organs also follow, and they have these cancer tissues, which may affect the backache. It goes to the spine, it goes to the liver and others. So that becomes now a systemic. So even in terms of treatment, we may not limit ourselves just to deal with the breast, because in Shumubiri once so that's a cancer disease hospital. So meaning we will reduce on the cost of traveling to Saka, and once the condition is detected early, the services will be brought as close as possible so that it can be done locally. Probably folks to wash and do it. Other than if you detect it at a later stage. Thank you so much.
Now, just in the same vein, I know that there's this practice by partners where a male will actually suck the breast of getting these cells, or maybe let's say the woman is breastfeeding. Let's use maybe that example. How safe is the baby before she even realizes that I have cancer?
Okay, so I think it's maybe before I get to that question, remember we discussed about what are some of the risky factors.
Yes.
So we would want, so they cannot get breast, but instead we're encouraging mothers to breastfeed as much as possible to actually reduce the risks of having this disease. Maybe my colleague can add something.
As I was asking you this question, I was listening to who's this guy? This musician. Just.
I actually didn't realize that's the word, but I've heard the song somewhere. So playing. You know.
I mean, that's the concept. That's the meaning.
I see.
Okay. That's highlighted.
No, I think that basically explains it all. Yeah, no one can. The baby cannot get breast cancer at all. Neither can the husband while sucking the breast get breast cancer.
I'm glad that you clarified that. Now, I know that there are a lot of myths when we talk about these diseases, and especially in an African setup, Zambia inclusive. You know, people have got a lot of about men also being at risk of having breast cancer. Are we looking at the same issues you had highlighted, where you said age? Obviously, apart from age, what else can we look out for in terms of who is at risk of getting this cancer, and what's the message to their families? What other things are we looking out for?
Yes, so thank you so much. Just like I earlier alluded to, with regards to the chances of men having breast cancer, it's quite slim, but I'm not saying they can't have. As long as it's a breast. Whether they are that gives someone the risk. So the risk might be the same, but usually in men it tends to come at an advanced age compared to women. I think that's what I can say.
And then you did mention alcohol consumption, cigarettes. Obviously, this is more prevalent, at which men will drink, and the rate at which women will drink will differ at some point.
And also, very important to mention, Mr. Zuru, is that risk factors who may actually and may not have the disease. So there should be other factors working hand in together for one to develop breast cancer.
Okay, gentlemen. Now let's get to family support. I know they're listening to us right now. Maybe they have a relative who has cancer, or maybe they are yet to know or identify that anyone in their family is predisposed to cancer. What type of support should they offer apart from prayers? Kaidi Muzambia kwa batinga kwa ba problem ya ife kufa ya papa first. Somewhere go on fight kuliama pepe.
People who deal with cancers, they are involved. Okay, people from the lab are involved because there's an issue of diagnosis, and also not neglecting the importance of family, because they are the people that offer social and emotional support. The church, the church is one place where most of us find comfort.
Yes.
We find, psychological support. It comes in very handy when it comes to multidisciplinary management of the patient.
Okay.
So I think the church is doing very well in it, Mr. Zulu. WHO says health, there has to be complete, mental state, physical state, as well as social state or financial
social state.
Yes.
Financial state.
Yeah,
yes.
So the financial aspect